I'm delighted to welcome my friend and colorectal surgical colleague, Dr. Cliff Coe. Dr. Coe is the director of the Division of Research and Optimal Patient Care at the American College of Surgeons. And I must say, as a side note, during my 8 years thus far as a regent, I've been incredibly impressed by the work that Cliff brings to us, by the quality of the programs that he's introduced, and by his in-depth knowledge of all of the nuances of the college quality programs, as well as interfacing from the American College to the outside world and bringing incredible credibility to payers and governmental agencies based upon the quality of our quality program. So welcome, Cliff.
Thank you. Thanks, Steve.
I'd like you to tell us a little bit about the background, the history of the Quality and Safety Conference. I'm not sure everyone watching and listening will have in-depth familiarity with that program.
Sure, I'd love to. Thanks. Well, first of all, thanks for having me, and I've really enjoyed all of your interviews with these leaders, and I'm really thrilled to be part of this, and so thanks for inviting me. The Quality Safety Conference initially started off as the NSQIP conference over a decade ago. When the ACS NSQIP program, the National Surgical Quality Improvement Program, first started, we had an annual meeting for all the participating hospitals and the team members of those hospitals to gather annually to share their lessons. And that grew from, a few hundred people into thousands of people. And then some of our other quality programs started coming to learn about quality improvement and share their lessons. And suddenly we just said, all right, maybe we should just have a quality and safety conference for all of our programs. And so for the past several years, that's what we've done, is have a quality and safety conference for the American College of Surgeons quality programs.
When you talk about the quality programs, perhaps you could just list for us which programs are included in the conferences. Many people watching and listening will undoubtedly have different interests from each other, and I'd like people to be aware of the wide array, the inventory of educational content.
Right. So the American College of Surgeons actually has over 20 different quality programs. The two oldest programs, as we refer to as the legacy programs, are the Commission on Cancer, with over 1,500 hospitals participating in the United States, and also the trauma programs, the trauma verification programs, and all of their pieces within the Committee on Trauma. But also ACS NSQIP, and we have a lot of registries. We have the Children's verification program for children's and pediatric surgery. We have a geriatric program for the other end of the spectrum. We have the metabolic and bariatric surgery program. We have the program you helped develop, the rectal cancer verification program, the breast cancer verification program. Folks should go to the ACS website, and they can see all of the programs that are available. But these are the ones of the participants come to this conference who attend, who participate in those programs.
Thanks very much. So while you're talking about the conference and participating to attend, perhaps you could walk us through what the virtual conference will look like to somebody participating. I mean, typically there's multiple parallel sessions, there's plenary sessions. I've always immensely enjoyed your opening of the plenary session. How is it going to work structurally this year?
Yeah, I think that we could think about the kind of different buckets of information. So one area of information are the clinical programs for these quality programs. So there's content, for example, from the trauma folks, the cancer folks, the metabolic and bariatric surgery folks. And so there's content for folks who participate or take care of patients in those topic areas. And so that's one area. There's also how I feel about it is general quality topic areas. So things like leadership or management and use of data, or teamwork, communication, quality in training, things like that. And so whether you're in a quality program or not, but if you are an operating surgeon, things like that will be very relevant to you. A third area is quality improvement basics and education. So if somebody is getting into this or wants to know more about what is Six Sigma, what is the difference between Six Sigma and Lean, what's a PDSA, how do all these fit together? Our hospital does this and sometimes does that. What do they really mean? We have a whole track and multiple sessions of just quality improvement basics. So those are three areas that I think are very relevant to almost anyone who might want to learn or attend and hear about quality improvement in surgery.
Would you mind highlighting for us some of the specific sessions? Give us a little taste of what might, some of the topics specifically, some of the speakers, just to whet our appetite for later this week.
Sure. So the conference is organized into three types of content areas. The first is our sessions. There are 60 plus sessions with 3 speakers and a discussion and an ongoing chat function where we can continue to chat with the speakers for a week after the conference is held. And some of these sessions, again, are content based on leadership in the time of crisis, in a COVID crisis. We're hearing from all different hospitals and leaders in those how important it is to have a group together, decision making, and how do you do multidisciplinary decision making. We have other sessions about statistical analyses of data and how do we know that if there's a blip in the graph, is that a real problem? Is that just something that we'll never see again? And how do we analyze the data? We have other things on how do you teach to the trainees quality improvement, and what are some things that effectively have been done in quality improvement projects in different academic centers. And then we have clinical topics in the metabolic and bariatric surgery. They have constantly new types of procedures coming up, and what's the efficacy and how do you do them? And so we have real kind of clinical topics that operating surgeons and the teams that take care of these patients might want to know. We also have these I can't wait to see these, our fireside chats. So every year we have a couple fireside chats. We have David Hoyt come and talk in front of an audience, get interviewed in front of an audience, and it has great reviews because you get to know the person and they kind of speak off the cuff about all types of questions. And so this year we decided to have more than a couple, and we kept on inviting people. And so we have almost 30 fireside chats with different leaders of areas. So Dr. Hoyt is one fireside chat, but people like Valerie Roosh and Patricia Turner, who are leaders of the American College of Surgeons. We have leaders in surgery overall, Selwyn Vickers, Diana Farmer, the new CEO of the Royal College in Canada, Susan Moffat-Bruce, shares with us her quality journey and how she foresees what's going to happen or what's happening in Canada. And of course, we have leaders in our programs, Eileen Bolger, Ronnie Stewart from trauma, Lisa Newman, and Heidi Nelson from cancer, and so forth. So the firesides are going to be really fun to watch.
That sounds very exciting and very interesting. You mentioned Canada, and that brings to mind something we've seen with all of the virtual meetings, that people no longer have constraints of travel and the expense of travel, and meetings which typically would attract a much larger contingent of domestic folks, whether the meeting is focused from here in the US or from another country, and people from around the world attending. Are you seeing in registration a shift in demographic?
Yeah, so usually that's a great point. We usually have, to our in-person meeting, folks from maybe 10 or 12 different countries. But this year, the registration, we have over 50 countries participating in the conference. So that's really amazing. And already, we just released the registration maybe a week or so ago, and already we have 4 times the number of registrants who are attending this conference. So it's really exciting for us to be able to kind of tell and share and hear what folks are doing in terms of quality in surgery across the world. So it's terrific.
While we're on the topic of sharing from across the world, do you also take advantage in the program of a bit more international faculty than we normally would have?
Yes. So especially in the areas of treating the pandemic and how to respond and recommendations from the pandemic. And also with your help, thank you very much, of surgical leaders and surgical team members who have experienced the pandemic in other countries. And so that's one thing. We work a lot in our programs with folks in, for example, Australia or Japan, obviously in Canada, and others everyone who does surgery can get better. And so we are hearing from a lot of folks from around the world in how they measure, how they improve, how we can benchmark, and basically overall how we can all treat our patients and continually to improve.
Well, it's very exciting indeed. Invention is often done from necessity, and it sounds like the necessity to avoid personal contact and maintain physical distancing has led to a fourfold increase in registration and a fivefold increase in the global reach of the program. So congratulations, that's wonderful. Perhaps you could talk us through the logistics. Typically in the Quality and Safety Conference, I can go listen to some general lecture on quality and then go off to a cancer session and then something on the NAPRC. Will people be able to go amongst rooms in the virtual sense the way they would in a physical sense?
Yes, so it's actually probably even easier virtually. And this is what I look forward to in this meeting and other conferences that are virtual, that you can see a whole bunch of things and not have to walk anywhere. You can just be right in front of your computer. And so people, all they have to do is register. It's free. And I think that's one of the reasons we also have increased registration, that it's free, and all the material is going to be just basically there on the site. We will release the final agenda probably in the next day or two, but if people go to the website at FACS.org, they can see a really cool word diagram that our communications folks put together that has a lot of the content pieces there, and people can get a flavor of what'll be in the conference.
And just to be sure everybody's clear, you mentioned go to the website. Could perhaps be even more explicit about how somebody registers.
Oh, sure. So if people go to the American College of Surgeons website, which is www.facs.org. Once they get onto there, there's a big picture of the Quality Safety Conference. They click on there, and then there's an area to register. Quick registration. Again, it's free, and then you're all set.
Well, excellent. It sounds exciting. I can see your enthusiasm. I can see your excitement, and it's palpable. I'm really looking forward to the end of the week to participating in what I'm sure is going to be an absolutely landmark, phenomenal quality and safety conference. I'm appreciative of your time and expertise, and also for your time and insights today during our interview. If you have any other parting comments, please make them. Otherwise, thanks a lot for your time.
Well, thank you. We're just excited about the conference, and please join us and visit the conference. It'd be terrific.
I echo those sentiments. There's no reason people can't go even for a 1-hour session at some point over the days of the conference.
Absolutely. Absolutely. Well, thank you.
Thank you. Look forward to seeing you in a virtual sense at the conference later this week.
Likewise.